I'm going to be talking to you on Help Me Trust You After My Misdiagnosis. I'm Sarah Clark. I have no disclosures to make. If we pause for a moment to start with and think about the average time it takes for a patient with EDS to get diagnosed, and consider the huge number of medical appointments during this diagnostic journey, these medical appointments are often littered with traumatizing and antagonistic clinical encounters where patients face medical invalidation. If you think about the psychological impact this long diagnostic journey has on these patients, what can we do to help these patients? When I'm listening to other people's presentations, I always find the About Me slides the most memorable and impactful. So what can I tell you about myself that has led me to give this presentation to you today? So I sit as a patient expert in the psychiatric and psychological aspects working group on the International Consortium. It's a role that I've only recently started, so I haven't yet had much involvement. I'm a published writer, amateur photographer, I have a bachelor's degree in geography. I'm a current student doing a master's degree in clinical and developmental neuropsychology. First started my master's because I'm interested in floating, and my long-term career aspirations are to research the clinical benefits of flotation therapy. Doing my master's dissertation on what are the daily experiences of autistic people living with hypermobile Ehlers-Danlos syndrome. I went through a very long, fraught diagnostic journey myself with around 15 to 16 years of physical symptoms before I was diagnosed with hypermobile Ehlers-Danlos syndrome in 2020. Through the autism lectures on my MSc course, I started wondering if I could be autistic. And I was diagnosed last May with autism spectrum condition. This presentation is a combination of my 2021 BMJ paper, Help Me Trust You After My Misdiagnosis, and my narrative piece in the Journal of Patient Experience last year, How to Help Your Complex Patient If You Don't Know What's Wrong. My interests include understanding the psychology of chronic illness identity and understanding the psychological trauma of the diagnostic journey and harm caused by misdiagnosis. Because of my interest in floating, I'm also interested in interoception, consciousness, and brainwave states. In our everyday vocabulary, words often float around, but sometimes we don't stop and think about what they actually mean. So what does the word diagnosis mean? According to the English dictionary, it is the discovery and naming of what is wrong with someone who is ill. Thought it would be very impactful to tell you a little bit about the difference my EDS diagnosis has made to me personally. So rewind to 2018, and I had become so conditioned through my chronic pain and fatigue that I was housebound. Couldn't walk for more than a few minutes at a time. At this stage, my EDS was undiagnosed. I'd been under a mental health team for 15 years following childhood trauma. I was misdiagnosed with emotionally unstable personality disorder. Unfortunately, with such a stigmatizing label on my medical notes, this really confounded my diagnostic journey with EDS. And for many years, I faced invalidation and wasn't believed about my physical symptoms. So between 2020 and 2023, I was diagnosed with EDS, autism, MELS, MCAS, PMDD, autonomic dysfunction, and I also have diagnosis of complex PTSD and OCD. So what has the difference been to being diagnosed with these conditions? It has meant that I've read a lot, I've learned a lot, and I've gone away and learned to self-manage. I'm not there 100% with my self-management, but the important thing is that I am a lot better than I used to be. Also had access following diagnosis to helpful treatment such as MCAS and recent input from speech and language therapy who have been working with me to do with my TMJ problems and jaw subluxation, and also to help me gain more insight into my communication differences as someone with late autism diagnosis. The key difference really is the diagnoses that I have now and the support I'm getting, including from my lecturers at university. I'm starting to finally thrive in my life. I know Dr. Hakeem always chuckles that I've managed to cram 6 charity fundraising challenges into the past year. However, these are interspersed with many hospital admissions where on some days I can't stand up without fainting and I need IV fluids. Often I'm also on a liquid-only diet. So the message here is don't judge a book by its cover, and just because I look well, there's an underlying story underneath that. So what does a diagnosis mean to a doctor? A doctor faced with the decision to give a patient a diagnosis can be a fine balancing act between formulating a medical explanation for patients suffering through the biomedical lens versus the risk of medicalization for that person. This can be dehumanizing for them. For a doctor, giving someone a diagnosis can mean that the patient can be put onto clinical treatment pathways for medical management, which may be in the form of surgery or medication. But what does a diagnosis mean to a patient such as myself? Because my diagnostic journey was so long and fraught, I faced many years of uncertainty and unease, not knowing what was wrong with me. Once I had been diagnosed appropriately, I then had access to appropriate management and treatment. Many patients find solace from receiving a diagnosis in the support they get from the patient community and patient organisations, such as the Ehlers-Danlos Society. For some patients, receiving a diagnosis can often lead to clues about related conditions and comorbidities. And receiving a diagnosis can lead to a patient learning how to self-manage and making meaningful adaptation to their life. Most importantly, a diagnosis can lead to avoiding iatrogenic harm from a misdiagnosis. I know that I've been in the situation myself a lot with my own doctors who have said, if we do more tests, it won't change the management. But for me, I wanted to know what was wrong. I wanted a diagnosis and to understand why I was suffering. I know some of the other presentations will go into much greater detail about why EDS and HSD are often overlooked, missed, or misdiagnosed. Firstly, with such a multi-systemic condition, and patients can end up under several specialists in different departments within a hospital, there's often a failure to join up the dots. There can be diagnostic overshadowing and symptom overlap, and unfortunately, many clinicians still lack appropriate knowledge around EDS and HSD. Many patients face such a long diagnostic journey with fraught medical invalidation, they may be attached labels such as psychogenic, somatic, and medically unexplained symptoms. These patients can develop anxiety as a secondary reaction to the invalidation they face. Speaking here as a highly complex patient who has in the past accrued a number of psychiatric diagnoses and misdiagnoses, I would like to caution against using mental health labels in the first line of your clinic letters. And this could lead to unconscious bias in your colleagues who haven't yet seen that patient. Also, with the old adage, you don't look sick and don't judge a book by its cover. Many patients with EDS actually look remarkably well, and it can be hard to understand how unwell they actually are. Recent paper called Comorbidity, Misdiagnoses and the Diagnostic Odyssey in Patients with Hypermobile EDS helpfully define misdiagnosis as a diagnostic label later understood to be inaccurate, and co-diagnosis as accurate diagnostic label and comorbidity. The study found that patients rejected their diagnosis if they thought it didn't accurately capture their illness experience or if the clinician was uninformed. Patients who go through such a long diagnostic journey can become highly traumatized by medical encounters that are unsuccessful, where they don't receive the support they need. It's a fairly taboo subject, but it's one that's important to talk about. And patients can actually develop medically induced PTSD and anxiety as a reaction to their difficult medical journey. Facing invalidation can delegitimize a patient's experience, leading them to question their own perception and doubt themselves. It can lead to dissatisfaction with the care provided, leading to hypervigilance and avoiding seeking future care, even in acute urgent situations, which I have done myself, and then become a lot more unwell because I didn't go to the hospital when I needed to. Even with a correct diagnosis, of course, some patients see a diagnosis as just a label and feel that a diagnosis can lead to stigma and discrimination. Some patients are frustrated with inadequate support and poor treatment availability. Ironically, I first learned the word iatrogenic harm from a clinic letter that one of my consultants had written when he was reluctant to arrange the tests that I thought I probably needed for fear of iatrogenic harm. However, in reality, because I didn't have those tests, I then became much more unwell. I thought it would be impactful if you hear a little bit more about my own diagnostic odyssey. So I've also already mentioned that I was diagnosed with EDS in February 2020. Following this, I then went through several years of severe pain after eating and severe gut motility issues requiring transanal irrigation. Even drinking water and liquid nutrition caused a huge amount of pain. Unfortunately, my mental health was continuously blamed, and I wasn't really believed about the physical symptoms to start with. Went through a fraught diagnostic journey with many barriers in the way to the tests that I thought I would probably needed. Along the way, I was misdiagnosed with all sorts of things, including neurotic depression, IBS, functional neurological disorder, I attracted labels such as psychosomatic, and I was told that my gut motility issues were due to my childhood trauma and my mental health. In essence, I wasn't believed. Over 4.5 years, I lost 9.5 stone. My hair started falling out through malnutrition. I became hugely physically unwell. Starting in 2021, I've been through the diagnostic workup for median arcuate ligament syndrome. I had a diagnostic celiac plexus nerve block in March 2023. The validation on this day from the pain consultant uttering those words, "I believe you," was amazing. I cried on the way out of the hospital, cried with relief from the validation, but also cried because it was the first time in 4 years I hadn't been in severe abdominal pain. This is a taboo subject, but if patients such as myself don't openly speak about this issue, nothing will change. I strongly, wholeheartedly believe that years I struggled with suicidality would never have got that bad if my diagnosis hadn't been delayed so severely, and if I hadn't received inappropriate misdiagnoses such as EPD and inappropriate treatment. I became sicker and sicker, and of course, thrown into this was my undiagnosed autism. Unfortunately, on several occasions, the healthcare system tried to section me under the Mental Health Act rather than relieve me around my physical symptoms and treat my physical problems. Patients who have faced misdiagnosis or a delayed diagnosis can literally lose years of their life. They can go through psychological harm from being told it's in your head and it's anxiety. This can intensify any pre-existing psychosocial difficulties they may already face. Then, of course, there's a physical harm. Patients become sicker and sicker and deconditioned. They can be put on wrong treatment pathways, subjected to unnecessary surgery and medication, and this can lead to longer-term problems. Also, in terms of my own late autism diagnosis, I know that looking back, there were many barriers I faced to accessing healthcare, such as I have huge difficulty around making phone calls. And I know that often when I've been in hospital, it's a hugely overstimulating environment, lots of bright noise, lots of bright lights. I didn't understand before my autism diagnosis why hospital appointments were so difficult for me. So collectively, how can we change the world and how can we change things for the future? So for both doctor and patient, it's important to remember that communication is a two-way process. Healthcare isn't just a thing done to a patient, and it's not just about what medicine or treatment to prescribe. For a clinical encounter to be successful and helpful, it's important the doctor and patient work together as a team in partnership and develop a therapeutic relationship. What can patients do? So it's important for us patients to remember that doctors are human beings and that they don't know everything. It's important to arm yourself with information and prepare for your appointment, but don't over-prepare because this could mean you come across as anxious. It's important to be persistent and trust your gut if you think that there is something wrong with you and you've repeatedly been told that there is nothing wrong. I'd thoroughly recommend looking at previous EDS conferences on YouTube and the information around how to prepare for your healthcare appointment. And for patients, with each new healthcare professional you see, I think it's important to step back and ask yourself around how you come across to your new doctor or new healthcare professional. You may form very entrenched views around the healthcare system if you've been through a long diagnostic journey. It's important to ask yourself, are you coming across as defensive, antagonistic, and fearful? Are you being over-assertive, and this can make you seem anxious? From the healthcare professional side of things, it's important to step back, and if your patient does seem anxious, consider, is there a reason? And perhaps it could be through their long diagnostic journey, they've come to not trust the healthcare system. What can doctors do? So, as I mentioned earlier, I think doctors giving consideration to the phrasing they use in their referral letters and clinic letters is very important here, especially around mention of mental health conditions, which can lead to your colleague prejudging and forming unconscious bias around a patient. It's important to take a person-centered approach and listen to your patient, and remember that to complex patients, the medical system can be highly traumatizing. And of course, any doctors can sign up to the EDS Echo program, which I've done a few of the courses myself, and I can thoroughly recommend. Rebuilding trust with patients previously invalidated and misdiagnosed takes time, compassion, empathy, and kindness. Clinicians need to be flexible and adaptable and willing to learn from their patients. Just as us patients need to remember that doctors are human beings, doctors need to remember that patients are human beings. We have a unique set of multidimensional needs. It's also important for clinicians to have a degree of transparency around your own clinical skills and refer to a colleague if you don't know something, rather than just tell the patient there's nothing wrong with them. This is from a 2011 study, so the time lag may now have caught up, but it's often quoted that the medical world is 17 years behind the research world. And it's not unusual for patients with complex conditions to be more knowledgeable around their health issues than their doctors, and likewise to be more up to date with current treatments. I think it's important for doctors to bear this in mind and not to necessarily label it as hypochondria. It's a huge myth that I've come across many times with many doctors that EDS cannot be treated and there's no point in diagnosing something that we cannot treat. Hands down, EDS can be treated, and I hope that by sharing a little of my own diagnostic journey and the progress and improvement I've made since receiving my EDS diagnosis, that you can all believe that a diagnosis makes a huge difference. Besides which, if a patient has MCAS and/or autonomic dysfunction as well, these can be easily treated through lifestyle changes and simple medical treatments. If you have been misdiagnosed or had a delayed diagnosis and a very long diagnostic journey, it's important to be kind to yourself. You're bound to go through all sorts of emotions, frustration, anger, and grief. You may feel regret for lost time, having lost years of your life. Patients can often go through a process of grief, coming to terms with their diagnosis, perhaps thinking about how their life could have been in a perfect world. In conclusion, within clinical encounters, there is a need to feel understood and validated. And the effects of an unsatisfactory human interaction within a healthcare system can be particularly devastating if a patient is already feeling very unwell. The invalidation can lead to very damaging effects and changes in emotion and behaviour, as well as physiological changes in the human body. Misdiagnosis, delayed diagnosis, invalidation, and unsuccessful clinical encounters and not receiving the care that you need can lead to worse outcomes in illness. The impact of not being listened to, not believed, dismissed, can lead to patients losing years of their life. The key is earlier diagnosis and better education around EDS and HSD. As a final comment, make healthcare about people, not just about illness. These are the references I've used and a few other useful resources for you to look at if you wish to. Finally, thank you for listening, and also thank you from me as a very complex patient to all the clinicians and those working in the EDS community dedicating their time and lives to help complex patients such as myself.